Alrighty, well, I have 4 o'clock on my end, so we're going to go ahead and get started. Thank you for being here. This is the Hope College Connection live series, our first one of this semester. So we're excited to kick it off with a great group of alumni joining us via panel and virtually today for our chemistry in the health industry. Just want to give you a few announcements and instructions. We want everyone here to participate today. So though we have some great panelists lined up, there are some amazing alumni we know on this call that have great valuable insight to share with one another as well as our students that are participating today. So feel free, if you have a question at any point, go down to the bottom of your screen, click the Q&A button, and we'll be sure to spend some time answering those live. You can also participate today by heading to the chat feature. Any other pieces of wisdom you want to share to our students or additional comments that add on to what our panelists are going to share, drop that into the chat. We will take that information, collect it, and put it in a one-page takeaway document for everyone that's in attendance today. Then if you haven't heard about our platform, the Hope College Connection, this is our counterpart to this series. It's an electronic platform similar to LinkedIn where you can connect with fellow alumni, maybe find that roommate you've been trying to track down, as well as connect with students for further conversations, experiential learning, even in mentorship as well. All you have to do to join that database, it's free for you, is go to connection.hope.edu. And one final announcement, the chemistry department faculty invite all alumni on the call today to stay on to connect for whatever time you have available. So there's going to be a separate Zoom link dropped into the chat as we conclude at 4:50. That'll take you to that separate room, and they would love to see you face to face and share some stories about your time at Hope. So with that, I'd love to introduce our moderator, James, who will get us started.
Hi, thank you for that. So I'm James Bird. I'm a senior here at Hope College, and I am studying biochemistry and molecular biology and planning to go into med school to study ophthalmology. So today, joining us on our panel, we have Dr. Lindsay Elworth, who is a neonatologist at CS Mott's Children's Hospital. And then we also have Stephanie Sanders, who is a clinical pharmacist and oncology intensive care at Hudson Care Institute at the University of Utah. Additionally, we might have David Paul joining us a little later. He is a neurology resident student at the University of Rochester School of Medicine. However, he had a last minute conflict come up, so we'll see if he'll be able to make it with us in time. So with that, we're going to just start off by going through a couple of questions for our panelists. And after about 25 to 30 minutes or so, we'll open up the floor to the questions that you guys have asked. So I guess to get started, after graduating from Hope College, what were some of the next steps that you guys took towards starting your career?
I'm happy to go first on that. So I'm Lindsay. I was a chemistry major, graduated in 2008. And I actually went right straight through to medical school. So I decided pretty early on by about sophomore year that med school was the right path for me after exploring some other fields in medicine. And so I took MCAT in third year and applied during fourth year and ended up out in Chicago at Loyola for medical school. That was a nice path for me because I ended up doing a residency and a fellowship. So it was already a lot of years of schooling. But looking back, I wish I would have taken a year or two in between.
And from my perspective, I'm Stephanie Sanders, formerly Stigler. I graduated from Hope in 1999 with a major in chemistry. And at the time, my path was a bit derailed in a sort of way in that I was also intending to be pre-med as I looked towards finishing my time at Hope. And then after I was at Hope, I actually had a tumor grow on the inside of my skull. And it was through that experience and kind of being derailed from the path of med school applications temporarily that I learned of the role of pharmacists and beyond the kind of traditional roles that I had known of at the time in the retail sector of pharmacy practice. And it got me thinking about other things I could possibly do with my chemistry background. And so through that derailing, I actually ended up applying to pharmacy school the year after, and so on and so forth. So for me, it was an unplanned excursion, as I didn't previously know what pharmacists could do. But I'm glad that it's the path I ended up on. So.
Yeah, no, it's amazing how something, it can seem so awful at first, led to something so cool. So how did you guys feel your chemistry from Hope College helped you find the right career path for you?
Stephanie, you want to take this one first?
Sure. So I think in terms of finding the right career path, it was in speaking with my advisor at Hope that I dove more into pursuing chemistry or pursuing pharmacy after, like I was still in connection with them after I graduated from Hope. I think that my education and degree at Hope certainly made me a competitive candidate for pharmacy school at the time. Pharmacy school does not require a separate bachelor's degree, though it's increasingly becoming the standard. But at the time, I was one in a minority that had a separate bachelor's degree. So it definitely helped me in applying and getting into pharmacy school. I think, in retrospect, it certainly helped me understand a lot of the chemistry that's involved in drug activity and physiology and understanding how drugs work and the stability of drug preparations and formulations and things like that. So it definitely was a huge help to my understanding and my success as a pharmacist. That was, certainly unplanned in a number of ways. But.
And on the pathway into medical school, I think coming from Hope, it had a really strong reputation beyond just what I had done at Hope. People knew of the research that was happening at Hope. They knew of the strong education you were coming in with. And actually, I met a lot of Hope grads along the interview trail, which was kind of nice. And so nice to have somebody know exactly where you came from during interview season. And then probably the biggest thing that my time with the chemistry department at Hope taught me was about research and what research could do. I had thought about doing an MD PhD program and ended up just doing a straight MD program during medical school, but I actually do a lot of research. I'm at an academic position at University of Michigan, and about 75% of my time is doing research that's very much chemistry based in metabolomics and milk composition. So even though I didn't necessarily think that was going to be my path when I started the application process, couldn't get away from it.
For sure. I know Hope's definitely known for prepping students, especially in the research field. So what was something that helped you both choose your specific field of study?
So in my time at Hope, Dr. Mungle was the pre-health advisory mentor, and he was like a huge part of why I ended up in medicine, with the support and the knowledge that he had, which included helping find people to shadow around the Holland area. I met my first neonatologist through connections through Hope, and that's really what started me on the pathway to peds and then my ultimate career.
I think for me, something that helped propel me towards my specific career within pharmacy of being first an oncology pharmacist and now a critical care pharmacist as well, was just the challenge and complexity and how compelling the field of oncology is. Just recognizing the nuances of all the medications involved in potentially trying to promote cure and eradication of tumors, while also promoting obviously survival of the patient, and how those things all intertwine, and the unique roles that pharmacists have with helping the supportive care and helping patients get through their therapies with all the help of medications they can, is really something that drew me towards oncology pharmacy specifically. Looking back, in pharmacy school, there's a dedicated course for multiple semesters on medicinal chemistry. And I'm incredibly grateful for everything I learned at Hope and how much that helped me, like I said before, really understand the chemistry of the medicines and how they interact with the body.
Awesome. That's really cool. So I guess looking back then from your experiences at Hope College, what advice would you give to someone? Sorry, let me rephrase that. What advice do you wish someone had given you when you were studying at Hope College?
For me, I felt a little bit like when I came into Hope, everybody was going pre-med, and it wasn't really talked about all the other areas that there are in medicine. And the med school path is a really hard path, and I think you need to know that you want to go down that path before you get too far along. And I wish people would have talked about other paths: PT, OT, speech, pharmacy, dietitians, all the other people that play into the healthcare role, rather than kind of there's so many other paths to take to, and maybe an MD or a DO is the right path for you, but maybe it's not, and that's okay too.
I would agree. I mean, my experience is obviously farther removed, 21, 22 years ago, which is crazy to think, but I do think that the focus was much more narrow on, moving towards being a physician or being a chemist. And it didn't feel, at least in my perspective, like I knew about a lot of the other options in between chemistry and faculty and being a physician or some kind of chemical engineer or something like that. And I also don't know that I truly appreciated all of the different things that you could end up doing with an understanding of chemistry.
That's all very good advice. So I know one of the most important things that seems now in today's age is networking and building connections with people. How would you guys have, or how would you say a network has helped you find opportunities in your profession?
Networking is huge. Sorry, go ahead.
Go ahead, you're fine.
Networking is huge in medicine. So I am not an extrovert by any means, very much an introvert. So networking is like the hardest thing for me to do and something that I have to force myself to do. And I don't think I was very good at it at Hope at all. But I think the earlier you start, the better. I was always nervous that people either didn't want shadowers in their office or didn't have time to be mentors. They do. It might take you a few like cold calls or cold emails to figure it out, but people are there and willing to help even during a pandemic, and people can get pretty creative with different ways. I can't imagine trying to get all the shadowing and volunteer hours with the restrictions that are happening in the hospitals right now. So don't worry and reach out because people are there to help.
Yeah, I would echo the same thing, that just get yourself out there, make some calls or emails. I have connections in pharmacy departments in many places across the country that I'm happy to help extend that to other people. And people are willing to have you shadow, have you help with certain other projects, maybe depending on the scope of what you're interested in and what they're doing. But it is a huge value to be able to network and to be able to put yourself out there. But I also was not quite as capable of doing it as 20 years ago as I am now. Certainly if you get into a certain industry or school path, then there will be professional meetings and things like that you can attend and start networking that way. And a lot of the different organizations for different professions they'll often have like a new practitioner group or a student group within the larger organization to help you start that networking process. So I would look for that depending on whatever area of healthcare or other professions that you're looking into.
Excellent. Thank you for that. So I know as students first start coming to college and even in their senior year, sometimes it can be rather scary, like trying to figure out what you're going to actually do with the chemistry degree, perhaps, because you might not necessarily want to go into research or you're not necessarily sure what you want to do yet. So what advice could you give a student who's getting a chemistry degree in finding the correct career path that they'll enjoy?
I think talking to your professors, talking to any mentors you have about the different options out there, and then thinking about how you see yourself in terms of what you think would make you feel successful. You know, we all determine or define success in different ways, and that can mean a wide variety of things for people, even within healthcare. You know, some people may want to, you know, focus more on their family, but then have part-time wanderings into medicine, pharmacy, dietitian, nursing, so on and so forth, and focus, you know, differing amounts of time on different things. But I would talk to people about the options out there, and then try to think for yourself about what you think would make you feel successful in your life, whatever that means. It doesn't have to be anyone else's definition of success.
I think the more time you can spend with people in different careers, the better, and more than just like a day with them. Like a day shadowing a general pediatrician doesn't really give you the full picture of what their week looks like or what their month looks like. So more consistency in who you're meeting up with. It's not just like a one-time visit, to try to really get an idea of what their life looks like, and do they have work-life balance or work-life integration is what we're being told it is now in the pandemic. But it's hard, and take your time. You don't have to know what you're going to do with the rest of your life the day after you graduate, and that's okay.
For sure. Thank you guys for that advice. So if there was one area in the chemistry major, back when you guys took the course, that you feel Hope could have offered to prepare you more for your career path, what area would that be in? Whether it be like more research oriented or more even just like a better understanding of like the job application process or things like that.
I think the most frustrating for me was trying to get all the volunteering and all the hours when I was on a busy chemistry major, trying to pretty much hold like a part-time, full-time job, getting in hours and shadowing on top of all of that. And at least this is now a decade ago, the resources just weren't there like I think they are today, as far as reaching out online and making connections that way to learn about what was happening. It was all word of mouth of what did people the years above you, where did they volunteer at? How did they get in there? What did that look like? So maybe that's a better situation than it was a decade ago, but that was really stressful.
Yeah, it is really, this was one of the questions, you know, that was really hard for me to think about, like what it would have been, because like I said, it's been 22 years since I graduated, and that's a full, you know, adult of time ago. I do think given, you know, given the resources and the information availability at the time, I think that they did, I don't know, I think that it was as well communicated as it could be, depending on what you'd expressed interest in. I don't know that there's anything in particular that I would anticipate needs to be particularly improved, just because I would assume that there's a lot more information available nowadays and more accessible. You know, like I said before, I think I just wish I'd had a better idea from the beginning of my college time, of my undergrad time, of what all the options were. And maybe if someone had like a kind of a real, maybe not super intense, but like a focused conversation as a freshman in entering the chemistry department. Okay, these are your options for what you can do. This is how you need to get there. You know, this is what you need to work on. Here's, maybe a way to parse out the volunteer hours or the other experiences you want to have along the way so that you're not scrambling to get certain things or certain experiences last minute when you don't have the time to do that if you are pursuing healthcare type things, because a lot of fields, not just physicians, but looking into PA school and so on and so forth, a lot of other areas of medicine also require volunteer and shadowing time. And like Dr. Ellsworth said, the cumulative and repetitive experience is really what gives you a chance to truly see what it is to practice in a certain type of medicine. And that a one day or half day or something experience is not really going to give you that perspective. So being able to have repeated exposures and have a better sense of the timeline ahead to get you where you want to go, I think would be the only thing I wish I'd had a better sense of then.
Excellent, thank you. And then I guess this is kind of more of a fun question, at least in my opinion, but what part of your education from Hope College, whether it be like even in the chemistry department or the gen eds or something, that surprised you in its usefulness in your chosen career?
Summer research. I think it taught me how to be an adult. It taught me how to think independently. And I think I took for granted and didn't really understand how fantastic of an experience that was, having now worked at a big academic center that does a lot of research in the lab. What we got to do as undergrads at Hope was incredible compared to what people are doing at other places. So I can't say enough about how beneficial that was. And just like such a cool experience looking back. I think Josh Warner is on the call, and we ran the particle accelerator. Like never would we get to do that anywhere else.
Yeah, I would agree. Looking back at some of the experiences I had and the intensity, I certainly don't know what the schedule is like now of when PChem is and so on and so forth, but the intensity of that class, and I remember it was like an all-day Tuesday thing. It was just like you were running your experiments, writing up everything, like every Tuesday was just this marathon session of a day. And the intensity of that and the rigor of the chemistry department altogether really prepared me well for pharmacy school. And while it's certainly a different perspective on what you have to learn, it was the rigor of the Hope chemistry department really prepared me well to succeed in pharmacy school. So I'm very grateful for that.
For sure. First year of med school compared to people who trained at other places was not that bad. And I think that's because like you were so used to working hard at Hope and balancing PChem and flying to interviews across the country for med school and still volunteering and still doing research hours. Like you already were doing it all at I think a phase that most people weren't.
That's really reassuring to hear.
I mean, it's so bad at times, don't get me wrong, but it was doable.
I believe it. So I suppose at this time then we can start reading off questions from the audience for you guys. So the first one that I have is from Therese Joffrey. I believe that's how you say his name. And it's, how did you balance a chemistry major, which can entail extensive research experience, with getting clinical hours for med school applications?
I had really long days and did a lot of things on the weekends. For me, I think one of having like gone through the application process, I think what I found out was most beneficial were those like longitudinal experiences that I had. So things that I started out doing as a freshman that kind of built up what kind of doctor I was going to become. And so for me, that was, I volunteered at the same places pretty much my whole time at Hope. I did Boys and Girls Club, the chemistry department. I don't know if they still do this, used to teach kids chemistry, like a camp on Saturday mornings. And so my sister and I taught that for years at the chemistry department, and did research during the summers, did research during the weekdays, and then volunteered at night. I volunteered at the hospital too. I think everybody, at least in my year, you all volunteered at the ER at Holland Hospital, and it was not that helpful. There are better experiences out there. But I guess I also had to give up something. So I saw in the question mark, did I study internationally? It just wasn't an option in my time frame to be able to go abroad and have a chemistry major to get all the classes in with the other experiences I needed. That ability to travel internationally, though, was very much available in med school and after that.
Yeah, I would agree with that. I did not do so during undergrad, but I was actually able to rotate for several months during pharmacy school to Bath, England, and spend some time working with the National Health Service there. So I was able to eventually have some international exposure that way, but not during undergrad.
Yeah, it's definitely making a couple of sacrifices trying to make time for everything, but it's really cool that you guys were able to still get like international exposure and stuff in med school. So we have another one here from Megan Smith that is asking, what did you do for your paid clinical hours before med school?
When I went through, we didn't need paid clinical hours. I'm actually not aware that you need paid hours now either. I haven't heard that. Maybe some people on the panel who've applied more recently or in the chat can answer that. Volunteer hours were all you needed at the time.
Okay. Awesome. Mary Kay is saying that we do not need paid hours, so I guess that makes that a little easier.
Although, to be honest, though, during the pandemic, you might have better luck getting your hours in a paid position than in volunteer. At least at the hospital that I'm at, we don't have any volunteers right now and are not going to for the foreseeable future.
For sure. That's a very good point. So we have another one from Dr. Denhofer-Reed, and she is asking, can you provide a bit of information about what a typical day might look like in your career?
I can start on this one. So as it mentioned in the beginning slides, I'm a clinical pharmacist in an oncology specific intensive care unit. So we are a 16-bed unit that cares for critically ill cancer patients with a variety of medical and surgical complications and illnesses. And so my day starts with what we call like pre-rounding, where I review all the patients assigned to my unit and to my list, review all the medications they're getting in a given day and whether those medicines are appropriate for their renal function, whether there are any clinically significant drug interactions that I need to be accounting for and maybe, dealing with. If there are new culture data, like for infections or new imaging findings that necessitate a change in medication therapy. So I review all the medications, I review all of their labs and other objective data, and then we participate in interdisciplinary team rounds. And so I round with either an anesthesiologist or pulmonary critical care intensivist, and then a set of PAs and NPs that help run our unit, as well as the patient nurses, social worker, and dietitian. And we discuss each patient in great depth and determine our plan for the day, accounting for all of those various disciplines and their input into the patient's care. So what the nurse has to say, what the dietitian has to say about how they're being fed, and so on and so forth. And I interject on any specific medication related concerns or things we need to change. And then we see the patients and actually, get a sense of what they really look like and how they're actually doing. Then after rounds, I will follow up on additional data as it comes in. In the ICU, data is never at a shortage and there's always new information. And then depending on the day, I also have pharmacy residents or pharmacy students on rotation. So I may be doing topic discussions or other education with them. I might be educating patients on discharge medications, although in an ICU, a discharge is pretty rare from our unit directly home. But I'll talk to patients about their home medications or their loved ones and make sure we've got an accurate list of whatever they're taking at home and understand what we do or don't need to be giving them while they're in the ICU. And I also have responsibilities at the College of Pharmacy and teaching students that way. I also serve as a residency program director. Residency is an option as a pharmacist. So I help with the training and education of pharmacists that way. I also educate nurses on the unit. And then I also respond to emergency situations throughout the hospital. So anytime there's a cardiac arrest or other urgent situation, I attend those and help with medication preparation and facilitation, administration, and things like that.
So my day when I'm at the hospital rounding is not that different from Stephanie's. So we have a 58-bed NICU. So there are a couple attendings on that take care of all of those patients. And we start with multidisciplinary rounds bright and early, and usually round till about lunchtime. So our rounds include physicians, residents, nurse practitioners, physician's assistants, dietitians, pharmacists, social workers, discharge planners, nursing. So I think as a PTOT, like everyone in the hospital that's taking care of our babies is on rounds. And then interspersed in that, I go to deliveries and do newborn resuscitations or newborn codes, do procedures throughout the day, consult moms who are anticipated to deliver babies early, and hopefully I'm out of the hospital by dinner time sometimes, depends on the day. But that's only about like a quarter to a half of my year. The other half is doing research. And so I do clinical translational research. And so those days have a little bit more flexibility to it that is consenting and recruiting patients into research studies, working with the IRB, the institutional review boards, creating protocols, and then some time in lab preparing samples and working with cores and running analysis. So I get a little bit of everything, which is a nice balance in medicine too, where if I decided I didn't want to do research anymore, I could just do clinical. And if I decided I wanted to do less clinical, I could do more research. So it all it's flexible, which is really nice too.
Yeah, that sounds really nice. I bet there's never a dull day with either one.
Yeah, it's busy.
So we have another question here from Therese Joffrey, and he is asking, what would you say are the benefits of a chemistry major versus like a biology or psychology for the pre-med-pre-health track?
At least for the application process, I don't think it matters at all. What you could be, dance, doesn't matter, as long as you've got the prerequisites and are well-rounded overall. I do think once I actually got into medical school and during residency and actually like the hands-on part of medicine, I do think that's where the chemistry major really helped out, and just like problem solving from all the time spent in lab and working through kind of difficult cases. I think that skill really translated nicely into medicine that people without that didn't have.
Beautiful. So we have another question then here from Abby Gift, and she is asking, how important is your GPA if you are well-rounded in every other area, especially when like applying to like through the application process?
So it matters. I don't think there's like a cutoff point. At least in my mind, Mary Kay, I think you're the new advisor. You can probably speak better to that than I can. But what I saw with my friends that were going through at the same time is med schools wanted to see that you were good in kind of all aspects of things, whether it was volunteer hours, hospital time, research, GPA, like everything needed to be good, but then some things needed to be great that made you stand out.
Yeah, I think GPA is one of those things where it definitely doesn't have to be perfect, but it does have to be high enough that you won't get overlooked for that alone, because in an increasingly large pool of applicants to pharmacy schools, medical schools, so on and so forth, there's just going to be a volume, where they might have a tendency to cut off above, or below a certain GPA, that just because of the numbers that you might not get looked at. But I don't think, differences of a 0.1, like a 0.1, difference in your GPA, or even a 0.2, 0.5 difference might not be the end all be all of your career and whatever you're looking at. It's just, you know, a certain minimum, and I can't speak to what that would be for different schools. You know, it's going to be different everywhere across the country, just depending on the size of their pool, that certain lower GPAs might not get looked at, but it's definitely not everything.
And I think schools just want to know that you're gonna, once they accept you into whatever professional program you're in, that you're gonna stick with it and stay there. And I think part of your GPA tells how strong you worked in undergrad, and how successful are you going to be in all the tests going forward. So do you have a really strong MCAT that makes up for some of your GPA, or do you have a really strong clinical experience in a hospital or outpatient setting that's going to show your dedication to it? I think that matters, but I agree with Stephanie, like you got to get through the first step of getting your application into the right bucket to be reviewed for an interview.
For sure. Thank you for that insight. So we have another one from Chris Rexroth, and he is asking, actually more directed towards you, Dr. Ellsworth. Can you go a little more into your decision about your choice between going the MD and PhD path? Like what factors played into your decision, and like what might it look like if you had decided to also do the PhD program?
So I'm going to be honest that I didn't do the MD PhD program because I didn't really know anybody that did MD PhD. I hadn't spent time with anybody. I knew I wanted to do the clinical part of medicine, and I knew I liked research, but I didn't know if I wanted to give up the clinical part of medicine to do research and to add that into my training without really knowing is really the main reason I didn't do it. I know there are other people on the call like Josh who went down the MD-PH program that can speak more to what that looks like. I now work with lots of people who have MD PhDs who are very successful clinically and research-wise. So I think it's much more of an individual decision and what you hope to get out of both pieces of the program.
Awesome. If you want to say something, Josh, go for it.
We am allowed to talk and you'll be good to go. All right, Josh, you are able to chime in.
Hi. All right. Yeah. So I'm Josh Warner. I worked very closely with Dr. Ellsworth when we were doing research in the particle accelerator back in leading up to 2008. And since then, I went directly to Mayo Clinic and did the MD PhD program there. MD PhD programs are a very different pathway. They're looking for some rather unique things. Specifically, they really want to attract the candidates that are going to finish the program. Like that when we're really getting down to brass tacks, that's actually what they really want. Because not a lot, but some people try and do that pathway because it generally will waive your tuition and give you a small stipend. Some people will say they want to do an MD PhD, and then when they would break off for the PhD a couple years into med school, they say, no, I'd really rather not. And they basically got half of a med school paid for. So that's what the programs do not want. So they have a different kind of calculus as far as what they're looking for. Being a lot of research background and people that are definitely interested in the PhD aspects. And I can continue if you like, or if anyone in particular is interested in that pathway, because it's probably a minority of people. I can toss my email in or have people connect with me, but I've been quite happy that I went down that pathway. I think it was right for me, but not right for everyone. And I would be happy to chat with anyone more about that.
Awesome. Thanks, Josh. Joanne, it looks like you have your hand raised, so I'm going to go ahead and allow you to talk here. So if you can ask a question or share a comment as well. Oh, looks like you put your hand down. Never mind. Awesome. I have a question for both of you, Stephanie and Lindsay. We're in a pandemic. I think not the huge focus of today's panel, but I would love if you could speak into your work-life integration, or maybe how your job's changed given the current circumstances of our world. Lindsay, I don't want to put you on the spot if you wouldn't mind kicking us off for this question.
Sure. So March was crazy and terrible at the hospital. I was pretty protected being in neonatology, so we've seen very few cases of infants with COVID, a handful of moms with COVID. But even though it didn't affect me by taking care of very many patients, it completely changed what work looked like for everybody at the hospital. So on the days that I go into the hospital, of course, everyone wears a mask. We social distance, so our multidisciplinary rounds are not as multidisciplinary as they were before. It's starting to feel kind of just like the new normal from that standpoint, but it's definitely different on times that I'm not taking care of patients. I try to work from home as much as possible, so that's been a big change. That is not always for the better.
I would say my experience has been somewhat similar in that when mid-March happened, there was quite a bit of chaos around work and lots of new information. It felt like multiple times a day and new plans on what we were going to do and how we were going to do it. I'm actually in the pool of pharmacists. So our ICU pharmacist group covers a variety of ICUs, and we as a group are the ICU I work in, and then the medical ICU, surgical, cardiovascular, burn, trauma, and surgical ICUs. And we actually had to open a new ICU just for COVID patients, and also fill up our medical ICU with COVID patients. So kind of adapting our workflow and plans to take care of all those patients was certainly a change for the group, and learning how to take care of them. It was certainly overwhelming, and it's been, I think since, the midsummer or so, it's become more comfortable in that we're no longer as uncertain of what we're doing. For the first few months in the MICU, there were a lot of questions because you didn't know whether what you were doing was the right thing for these patients, because it was, a lot of things were based on speculation or unpublished trial data, unverified information that was circulating around. So there was a lot of uncertainty and a lot of anxiety about not whether we were doing the right things for patients. I think now in the units that take care of the majority of COVID patients, it's a lot more comfortable being, knowing that what we're doing is probably the best for them based on the evidence we have so far, and we have more data to help support our choices in caring for those patients. But yeah, like Lindsay said, everyone wears a mask every day, all day, every day, and eyewear, and we're all distanced. It did force us to look at how we could work remotely and what technologies we could employ to be able to work at a distance. So we're all now pros on like Teams and Skype and Zoom, and we had to do all of our residency interviews all on Zoom this year. So it's definitely been a change, but I would also say that it does feel now kind of like we're in this new normal phase of just how life is at work. It's been, I don't know, a really interesting time, I guess, if nothing else.
Thank you. So we have another question that was asking about what are some of the common mistakes that you see people making who are earlier in their career fields?
I think in medicine, people tend to pigeonhole themselves into one specialty of, I'm walking in, I'm going to be a dermatologist, without opening their eyes up to the different fields. And I think it takes time during medical school to find new mentors and build new relationships and get new experiences before you actually decide. So I'd say go in open-minded, because you might surprise yourself.
Yeah, I would say the same, just that you don't want to base your decisions or commit to one thing in particular based on a minimal exposure to something, because it may be totally different than what you think it is. Much like I thought about what a pharmacist could be. I had no idea the depth and like integration I could have with the team, and the level to which my opinion matters, and how important I am on my team. So it was really something I really had no idea about.
I think the other thing too is, just because you like someone in whatever specialty you choose does not mean that that's the right reason to choose that specialty. Like, spend time with multiple people in that field and get a better sense of what the whole field is like, not just a personality fit.
Very fair. So we have another question from Eric Salisbury, and he's asking, what's research like in an MD program? And do you ever feel like your current research that you're doing now, Dr. Ellsworth, would benefit from possibly going through the PhD program?
So good question. So I did research in medical school, residency, fellowship. I continued it throughout the way. It just took different forms, from bench work that transitioned to clinical, and then transitioned to something in between that, and ended up more clinical translational. And I think it was helpful to see all the different aspects of how research is used in medicine that is truly bench to patient care. And there's a lot to do and a lot of questions to ask that I don't think you fully understand until you're taking care of patients. A PhD for me would not have ultimately been the right answer. I don't plan on having a lab of my own one day. I am in a different kind of role in research than maybe a traditional MD PhD would be in, with more clinical needs. That being said, while I haven't taken the classes to get a PhD, that doesn't mean I haven't taken a lot of classes to get the skills that I need. So whether it's stats classes at U of M or clinical research trial classes, you kind of get the knowledge that you need to build your career around. And so that's how it's been for me.
Awesome, thank you. So we have another one from Dr. Reed, and she's asking, so what does your life work integration look like, and how has it changed over time, as well as what was your most memorable experience at Hope?
My life work integration, I'd say it's pretty balanced. I am admittedly, a workaholic, if you will, in that I love my work. I love doing my job well. So I do stay as long as is necessary to get it done correctly. But I do balance that with 2 young children and a family at home. So, I have a supportive husband who's actually also a pharmacist, works at the same hospital as I do. So we balance everything between the 2 of us and our schedules. But it is, it is trying at times. Certainly there's long days, and there's, I also work on research, and there's certain timelines you set for yourself that you want to adhere to with getting things submitted for publication. And it is a balancing act. I think, pharmacy in particular has a really wide variety of things you can do. And so you can have as much work or as little as you want, and do different things with it. How that's changed over time just depends on kind of what's going on at work. And certainly the pandemic has inflicted new things into our daily work, and new studies and new research. We're looking at people on trials all the time for different COVID type things. But I think it's, I don't know, I think it's been pretty well balanced, I would say. But it's based on your own choice of what you want to get out of it, and how much you want to put in on the work side of things.
I think similar for me. It honestly depends on the day as to whether it's a good balance or not. When I'm on service, it's not the best balance. It's early mornings, really late nights doing patient care and signing notes till I go to bed. And those aren't great, but it's for 2 weeks at a time. And then I go back to having a little bit more flexibility. I will say work from home has made work-life balance a lot harder because there's no longer a clear distinction between work and home. So trying to sort through how you do that at home has been interesting for everyone. For me, it's making an office and dedicating space in my house to work from home and setting some limits. I think the younger generation is talking a lot more about work-life balance and how to manage stress and manage burnout. And it's a part, at least through medical school residency and beyond, it's something people are talking about and trying to give you tools and strategies to help with that and acknowledge that it's still not perfect.
Awesome. Thank you. I'd imagine COVID has definitely made those lines a little bit more blurry. So we have another question from Eric, and he's asking, research in med school, like he's asking, did it feel required, or was it more of an optional thing? And was it more of an option to bolster your residency matching, or was it just kind of a personal interest for you?
So definitely not required. Mine was a personal interest. So mine actually started with a mentor in neonatology, and I did neonatology research, clinical research in residency. So it was more of like an interest and passion in the field and to learn more about this potential career path rather than like a true kind of research hardcore bench work that I had done in my time at Hope. So it was very different and really opened up my career path more than anything to a mentor I still have today. And I don't want to say it's not required because I think in medicine, it very much depends on what subspecialty or pathway you're going into as to how necessary that is on your resume or not. Pediatrics, it's not. Whether you did research or volunteering or spent time abroad, it wasn't looked at any differently.
Awesome, thank you. And then this is our going to be our last question for the night, and it's actually directed at Josh. And it's asking, with doing the MD PhD program, what was the sequence of your education, and did the PhD portion prevent you from doing things like your residency, or like was that all, like how's that all fit together?
So for the purposes of, I did put an answer to that in the chat because I wasn't sure if it would be too specific for to be answered overall. But basically, most programs, there's a little bit of variation out there, but most programs will split the MD. There's preclinical sort of lecture-based book learning years, and then USMLE Step 1 happens, and most MD PhD programs will split the PhD off at that time, and you'll do the entire PhD until it's done, after which point you re-enter the med school and finish your clinical years, the latter nominally half of med school, and then you basically follow a normal course as far as medicine is concerned. You do still have to do residency. That's not really an optional thing unless you don't intend to practice, because the third step of the USMLE happens in your first year after you're out of medical school. As for my personal clinical research ratio, I'm finishing my residency now, actually, because of the PhD taking me a little bit longer. And so right now it's a little bit more directed in the clinical side, and but that will evolve moving forward. I'd echo similar comments to what Dr. Ellsworth said earlier about having the luxury to kind of engage with research to the degree that I would like, and having the MD to potentially fall back on if either grants or projects aren't quite working out as I would hope. So we'll see how that goes.
Awesome, thank you. And I think that's all of our questions for the evening. Just a reminder to the alumni that there's going to be like a meet and greet immediately following this link or video meet, and the link for that will be in the chat. Additionally, I would just like to thank Dr. Sanders and Dr. Ellsworth for coming and talking to us and like giving up your time to answer all of our questions. We really appreciate it.